Thousands of nurses left wards and took to the streets today protesting for better pay and staffing. Pickets and rallies took place at hospitals around the country in the first nurses' strike in nearly 3 decades. Hospitals felt the pressure but appear to be coping. In fact, we've been hearing throughout the program that some hospitals had more volunteers and emergency cover on than nurses who are normally rostered in the same wards. We're trying to get confirmation of that from the hospitals themselves. It will be fascinating if that is the case. But looking at the picture across the country, here's our health correspondent, Karen Brown.
Up to 50 nurses braved chilly weather in Wellington to wait outside Wellington Hospital shortly before 7 o'clock this morning to welcome their striking colleagues as they joined the picket. Their ranks swelled to over 100 and strong public support added to their jubilant mood. Registered nurse Katrina Hopkinson, who works in post-anaesthetic care at Wellington Hospital, says safe staffing, or the lack of it, is a major worry for nurses.
The time is now, and we'd rather be on our wards doing our work today and not out here on the picket line. We want a fair and reasonable offer that we can accept and get on with our job.
The Nurses Union delegate thinks there's enough money for their offer to be boosted.
We know that the government has a surplus and there is more money. We don't want more than what is fair and reasonable, and we're saying the time is now. We can't wait for 2020 for safe staffing, and we can't wait for 2020 for a decent pay rise.
And it's short staffing that's on the mind of Wellington nurse Leon.
We've got busier and busier as time has gone on, and it's been feeling more and more unsafe as time has gone on.
Stephanie Watts, who's nursed for more than 40 years, joined thousands of people to march up Queen Street in Auckland. She says the extra $38 million that DHBs have promised for 500 new nursing staff is pitiful.
$886 million to Mycoplasma bovis, $100 million to America's Cup, $2.3 billion for the 4 defence planes, ACC flush fund of $607 million, and we're at the bottom of the heap at $38 million.
In Christchurch, a patient, Jamie Carter, was outside the city's hospital watching the action. He says the wards are quiet.
Yeah, it's pretty laid back and there's not much nurses around, but yeah, hopefully the staff should be more staff on tomorrow here to help out with the patients.
But nurses clearly had a lot on their minds.
A few conversations going around with the nurses and all about what's going on today. And, yeah.
A Christchurch nurse, Roger Stahl, says he was better off working in Australia.
It certainly helps if you've got that, you're getting paid for what you're worth for. I think the income I was getting, I've been back 11 years, I was getting more there now than I am here 11 years ago.
Hawke's Bay had to call on the union today to provide 4 extra nurses to help it manage a full hospital because of winter ailments and other demands. DHBs have confirmed another hospital also needed to call in more staff but refused to name it. Otherwise, it says all hospitals have coped well given the circumstances. It's estimated up to 8,000 elective procedures were deferred due to the strike. Neither the Nurses Union nor the DHBs will say when talks will resume in the long-running dispute. Union spokesperson C. Payne says whether they strike again will be up to members.
We'll be sitting down, talking with our members, talking with our delegates, key delegates and the bargaining team, early next week.
The DHB's lead chief executive, Helen Mason, says they'll be talking to nurses soon about the recommendations from the Employment Relations Authority facilitator.
DHBs are going to be considering those recommendations, and we will be making contact with NZNO to talk about the recommendations and to agree a path forward.
But with the government adamant there's no more money in the kitty to boost the offer and thousands of nurses convinced they're still undervalued, it's not clear what that path is going to look like. Mō te hōtaka o te ahi ahi, ko Karen Brown tēnei.